Hello, friends. Welcome back to the Test Those Breasts podcast. I am your host, Jamie Vaughn. I'm a retired teacher of 20 years and a breast cancer thriver turned staunch, unapologetic, loud supporter and advocate for others, bringing education and awareness through a myriad of medical experts, therapists, caregivers, and other survivors. A breast cancer diagnosis is incredibly overwhelming with the mounds of information out there, especially on Dr. Google. I get it. I'm not a doctor, and I know how important it is to uncover accurate information, which is my ongoing mission through my nonprofit. The podcast includes personal stories and opinions from breast cancer survivors and professional physicians, providing the most up-to-date information at the time of recording. Evidence, research, and practices are always changing, so please check the date of the recording and always refer to your medical professionals for the most up-to-date information. I hope you find this podcast a source of inspiration and support from my guests. Their contact information is in the show notes, so please feel free to reach out to them. We have an enormous breast cancer community ready to support you in so many ways. Now let's listen to the next episode of Test Those Breasts. Well, welcome back to this episode of Test Those Breasts. I am your host, Jamie Vaughn, and today I am so excited and honored to have my guest, Dr. Robyn Roth, on my show. So Dr. Robyn is a board-certified breast radiologist, associate professor of radiology, and the founder of the Boobie Docs. This is a breast health education platform she launched in 2020 to empower women with evidence-based information about breast cancer risks and early detection. She hosts the Girlfriend's Guide to Breast Cancer podcast and is a familiar face on NBC, ABC, and PBS NewsHour. Well, welcome, Dr. Roth, to Test Those Breasts podcast. It's so nice to have you on the show. How are you doing today?
Thank you so much. I'm so happy to be there. Please call me Robyn. And I'm very excited to be here today and talk to you about all things breast health.
Me too. And thank you. Thank you, Robyn. Well, to my audience, I don't know if you're following the Boobie Docs, or if you're not, you need to be following, because it just has a plethora of amazing, really important information from Robyn. And so, Robyn, what I would like to do is to ask you first, who is Robyn? Like, who are you outside of the Boobie Docs? What drew you? What made you start the found the Boobie Docs, and what's the mission?
Yeah, so I am a breast radiologist. So that means I'm the doctor who you would meet if the doctor who'd be reading your mammogram, ultrasound, MRI, all your breast imaging. I'm also the doctor that you would meet if any of those tests were abnormal, or if you needed a biopsy. And in many cases, I'm the first doctor that someone meets when they receive the news that they unfortunately have been diagnosed with breast cancer, which is a role that I take very seriously. And I realize that I'm having the hardest conversation with, people. I'm telling people the news on the hardest day of their life. Right. And from there is where kind of the Boobie Docs came from, because I realized that after I gave the diagnosis, they had lots of questions. They had questions about why me, how did this happen, what are the next steps in my breast cancer journey. And so I realized that there was, one, a lot of misinformation online, especially about mammogram safety, radiation safety. And number two, this is where patients were getting the information from. And also number three is that, they needed a good resource, someone that they can count on before they had breast cancer or turn to after they had breast cancer. So that's how the Boobie Docs was formed. I started it back in 2020 as a way to reach patients, women, anyone, men too, with, anyone with breasts should follow the Boobie Docs. And my goal is to get out reliable, educational information in a fun, non-threatening way. Because I think a lot of times, if I say follow my breast cancer page, no one's going to want to follow that. And that's why the Boobie Docs, it's like a little silly, but, I think it's more catchy than perhaps the breast radiologist or the breast doc, which is what I am. I'm also a mom of three, and that's where my three young kids, and that's where, my children's book and teaching kids about breasts from an early age comes from as well.
Well, and thank you for that because I just bought your
Mhm.
book, Everyone Has Boobies, and I read it to my 10-year-old granddaughter and she loved it. So those
Oh,
of you who are watching or not watching this, you can watch on YouTube as well. Robyn is holding up her new book, Everyone Has Boobies, and it is absolutely adorable. And my
thank you.
granddaughter and I had a conversation about anatomy. She knows what
Mhm.
anatomy is. And we talked about how boobies are just a blob of fat and all mammals have them. And she had her little tiger, who is her support animal that she brings
Mhm.
everywhere, mental health support animal, she calls it.
Mhm.
And we were talking about how many boobies their tiger
Mhm.
has. And so it was just a really cute way to kind of ease into talking about, hey, we are should not be ashamed of our anatomy, and men and women,
Absolutely.
boys and girls. And so when I asked her what she learned from it at the end, I said, what is something you learned? And she says, I learned that babies have boobies. And I'm
Mhm.
like, yeah, you're right, babies have boobies.
That's right. And my
Yeah.
goal of the book is really to destigmatize breasts because I think from early age we're taught to be ashamed. We don't speak about them, and that follows us throughout our lifetime. And that
Yeah.
really does kind of into our adulthood. It really dictates how we talk about our breasts or lack thereof. Like we're ashamed to talk about them with our doctors, with our partners. And I think this is part one of me trying to lift the shame off that and also open up the conversation about breast cancer. If you don't mind, I'm going to read a little blurb from it, but this is
Absolutely.
me. This is me as a cartoon character, by the way, and these are my kids, two of them. But boobies can get boo-boos and have a scar or two. My mommy's boobies have a scar. My daddy has one too. But if boobies get a boo-boo, there are things that doctors can do. We can find it, we can shrink it, we can fry it, we can freeze it, we can cut it, we can cure it, and make that booby boo boo go bye bye bye. So
I love
hoping
that.
it's a tool. And then there's resources at the end, which I think are very important. So if your booby has a boo boo, here are resources that can help you.
Love the resources.
So
It's interesting because my granddaughters call me Glamma,
I
and
love
they
that.
have and our daughter, who is my stepdaughter, she just had a breast reduction. She was
Hmm.
enormous and having really bad back problems. So she knows that her mom had a breast reduction and Glamma had breast cancer and
Hmm.
had a mastectomy. And so she knows that whole story about how,
Hmm.
different things happen to boobies, right?
That's good. And do you know that having a breast reduction actually lowers your risk of breast cancer because you're
I
just
heard
removing
that.
some breast tissue? Yeah.
I heard that, and
Yeah.
I did let my daughter know, and I think that that is something worth, worth the information. So,
Yeah,
um,
absolutely.
so I really want to get into something that's really bothering me, and I know it's
Let's
bothering you
talk about
too,
it.
because it is so confusing. Because what you do and what I do, I teach breast health classes. I'm a lemonista with Know Your Lemons.
Hmm.
I'm about to launch a new initiative through Test Those Breasts called the MBA program, and it is to educate women and men between the ages of 18 and 30. And it's going to be launching in the beginning of June. And so
Mm.
when I saw this new information coming out from the
Yeah.
American College of Physicians of these new guidelines of breast screening, and it's like, what are we doing, walking backwards?
Yeah, when you say
What?
new, I have it in quotations because this is old information that has been debunked. I don't know what the American College of Physicians was doing in coming out with this. They basically, 40 every year saves the most lives, period, for average risk women. Okay. Now,
Okay.
there are organizations that have come out to say, well, because there's false positives and young people are more likely to be called back. And because of that, we're going to say 50 and we're going to say every 2 years. And which is crazy to me because we don't, that is a very paternalistic approach to medicine to say, yeah, 40, getting a mammogram at age 40 every year, if you're average risk, saves the most lives. But I don't want you to have to worry about, it's don't you worry your pretty little head about breast cancer. Like, don't worry, we've got it covered. And it's like not giving people the information. It's really placing values on screening recommendations, which I think is ludicrous. Like, we don't have that type of paternalism for prostate cancer screening recommendations or colon cancer screening recommendations. So why instill your values about getting called back and false positives onto breast cancer screening recommendations. So, you know, all the experts, all the breast cancer experts, the cancer experts are coming down hard on this. Like, this is
Good.
inappropriate. The USPTF, pushed back the screening age to 50 a few years ago. And recently they lowered it back again to 40. They said we were wrong. Like, women in their 40s are one third of lives lost from breast cancer are from women in their 40s. So saying you're not going to screen them is really a dangerous, slippery slope. If anything, you hear people online saying it should be 35. And it should, with AI and what we're going to start seeing with what we're able to detect from a mammogram, we are probably going to be doing more of a baseline at 35 and learn your 5-year risk of breast cancer and see if you're the type of person that we need to screen more often, because we're going to start seeing more of an individualized approach. 50 every 2 years might be okay for some people, but not if you're a proactive woman in your 40s, especially if dense breast tissue or family history. Like, that is just not enough. We learn the hard way when women don't come in every year for their mammogram. They're getting diagnosed with more late stage cancers, and
Okay.
that causes delayed, worse prognosis and more aggressive treatments.
So I have a question for you then. I
Yes.
have a friend of mine who is, I think she's 61.
Mm-hmm.
Her doctor has told her every 2 years.
Mm-hmm.
That confused me because I mean, I'm like,
Yeah.
how do you respond to that?
I mean, I think she really needs to understand her personal risk of breast cancer. What is her risk of developing breast cancer? If you come every year, you're less likely to be called back falsely. Like, we have just better information because you're more consistent about going. We have more comparisons. So really, if you're a proactive patient who believes that early detection is the best protection, which it is, because when we find your cancer at, like, localized to the breast, stage 0-1, we have 99% 5-year survival rate. So, that number is good, but it goes down with more delayed stage prognosis. And, I think it really comes down to, what do you value?
Mhm.
Are you someone who, if you had breast cancer, would you want to know about it and treat it as early as possible? Or, if you like, ignorance is bliss. Like, for some people who are very anxious about the whole process, maybe they're an every 2-year type of person, but I really think that women have to understand that every year saves the most lives.
Okay. Well,
Finds your breast cancer early.
I did let her know that it should be every year, and she also has dense
Mm-hmm.
breast tissue. So I
Mm-hmm.
I encouraged her to have another conversation or move along to
Yeah.
another
So
doctor.
exactly, dense breast tissue is its own double-edged sword, because
Yeah.
we know that dense breast tissue, about 50% of women have dense breast tissue. It's not abnormal. It's just something that your breast is composed of more fibroglandular tissue than fat.
Yeah.
And it's important to know because, it makes it harder to find small breast cancers on a mammogram alone, because dense breast tissue appears white on a mammogram. So do breast cancers. So think of it like finding a snowflake in a blizzard. The more
Mhm.
snow you have, the harder it is to find a single snowflake. Additionally, we also know that having dense breast tissue increases your risk for developing breast cancer. This is where breast cancers are forming. This is the active tissue. So it's kind of like a double-edged sword. It makes it harder to find small breast
Mhm.
cancers, and it increases your risk, which is why I am a strong proponent of supplemental screening if you have dense breast tissue. So adding an ultrasound or an MRI to your annual mammogram helps us find smaller, more treatable breast cancers at an earlier stage.
So when I got breast cancer, I had two big screens up there with my
Mm-hmm.
doctor saying, we have groupings of calcification on this one, and we have an associated mass over here. So I've
Mm-hmm.
always gotten, screenings. I've always gotten the ultrasounds on top of the mammogram. Can we
Great.
address one more thing here? Because
Of course.
this really bugs me too. I am currently sitting here watching a post of this lady saying that wearing bras cause cancer. Well, we know
Mm-hmm.
that's not true.
Yes.
And it has been debunked along. And so I put in there the research and everything. And I think I had one of it was like the American Cancer Society. Of course, people are all over that saying, oh, you're going to trust the American Cancer Society.
Mm-hmm.
Well, the conversation took a turn and it said something like mammograms cause cancer. And I hear this and
Mm.
I'm like, what are you? So I know you
Let's
get
talk
this a
about
lot.
it. Yeah, I
Let's
mean,
talk
this is
about it.
the that's the lie that put me on social media in the first place. Was this, I think that mammograms have been very villainized because it is an X-ray of the breast. It has a very small amount of radiation. We're exposed to radiation all the time. There's radiation in your banana. There's radiation from the walls in your home and from the stars. So we are exposed to a certain level of background radiation. So a mammogram has a very small amount of radiation that's equivalent to about 7 weeks of background radiation, but it allows us to detect calcifications and subtle areas of architectural distortion that we cannot detect on ultrasound or MRI or QT imaging or thermograms or all these other things that people are trying to sell you on. I feel that a lot of times the people that are trying to tell you or convince you that mammograms cause cancer are usually doing it because they are trying to sell you something alternatively that is not approved to detect your breast cancer. So in many cases, it might be a QT imaging or some radiation blocking, a supplement that you could take before your mammogram to lower the risk, or some parasite cleanse or something that is not evidence-based. So yes, there is a small amount of radiation in a mammogram. Yes, too much radiation is a bad thing, but that's not the levels we're talking about in a mammogram. You should be getting a mammogram once, maybe twice a year. And again, this is not the levels we're talking about, like for a CT scan or a PET scan. Like those have much more radiation. This is a very low dose of your X-ray to your breast, small amounts. Like it's more likely that the mammogram will save your life rather than cause a theoretical breast cancer from this
Right,
very low
right.
dose.
Yeah. Thank you
And
for addressing that.
and the argument is that, like, we are seeing in my clinic, we are seeing more and more young people being diagnosed with breast cancer, many of whom never had a mammogram. So it's not the mammograms. And by blaming it on that and scaring people away from getting mammograms, we're really taking a step back with all the work we've done over the past few years to lower breast cancer mortality. A lot of that is because early detection because of mammograms.
That is a really good way to explain it. Thank you for
Hmm.
that, for arming
Hmm.
me with something to say, because
Yeah.
I have, quite a few, podcast episodes, and so many women that I have interviewed are young and they got it when they were in their late 20s, early 30s, never had a mammogram. So that's a
Yeah.
very good point. Yeah.
Yeah.
Um, do we, is there anything that we can say that, I know that there's been studies about alcohol and cancer, because a lot of people are like, oh, you ate too much soy, or,
Hmm.
things like that. How do we address people who are wondering how they caused their own cancer?
Well, number one, you didn't cause your own breast cancer. And I think that's something that we have to take the blame off the patient, because there are things in our power to control, like, limiting alcohol, limiting smoking, maintaining a healthy weight, exercising, green diet. But there are lots of things that are out of our control. Number one, the environment. There are environmental factors all over the place. And I do believe that something is going on in our environment that is causing these younger and younger people to get breast cancer. So there's environmental factors, there's, genetic factors, and family factors are small. It's only about 5 to 10% of patients. But, there are lots of things. And you could see, I've spoken to many women who have done everything right, on paper. They've, maintained a healthy weight. They run marathons. They have a clean lifestyle, but they're still developing breast cancer. So it's more than, like, it's not because you had to drink too much to drink at your cousin's wedding, or, you ate that McDonald's at one time. Like, that is not how cancer works. It's accumulation of a lot of things. Many of them are out of our control. So not just one thing. And I think that's really important, to take the blame off the patient.
Gosh, because people have that guilt, like, what did
I
I
know.
do? I was at the
And
healthiest of my life,
yeah.
and
And I think guilt really weighs on us too, like, and eats away at something inside us, whether it's, causing cancer of, like, long-standing guilt. Like, I do believe that there are some, when we talk about root causes, like, things that we hold on to in our bodies, and traumas that could be related. But again, it's not one thing, it's like everything combined.
Yeah.
So
Yeah.
I just think we have to let go of this guilt and this blame that people often, what did you do wrong
Yeah. I like
to
that. Yeah.
deserve that? Yeah, you
Um,
didn't.
I was able to go to the breast cancer symposium this year, and it was so mind-boggling, eye-opening,
Hmm.
really, really a great experience for me because I didn't realize how important patient advocates are, and
Hmm.
that I
Powerful.
was part of that. And it just made me realize that, that we are the bridge between the patient and the researchers and the doctors. And I will definitely be going every single year. One of the things that you have brought up is this AI. What is
Hmm.
going on with that? Can you give my audience, our audience, a
Hmm.
little bit about that?
Yeah, so we've been using AI in radiology for a long time, especially in breast imaging. We have something called computer automated detection that can help detect calcifications. But the thing about AI to this point, it hasn't been very good. Like it's oversensitive. They'll call something and I'm like, oh, that's just vascular calcifications. But it's getting better and better. And what I think we're going to be seeing a lot in the radiology side is more of number one, the biggest AI revelation coming out in the next few years is this clarity AI. So basically, from a mammogram, when we talk about breast cancer risk, we usually use these outdated risk models that are not good at predicting who will actually develop breast cancer. But with these newer mammogram um, AI models. Basically, it could take a picture of your breast using a mammogram, and at the cellular level, it can tell you your 5-year risk of developing breast cancer. It's much more accurate than a
Nice.
lot of these calculators. And that's really exciting because it can tell you your 5-year and your lifetime risk of developing breast cancer. So you can decide which are the 30-year-olds that we maybe need to screen. Who are the 30-year-olds that are more likely to develop breast cancer? Because we know they're out there. We're just having a hard time identifying them. So I think it's going to help us decide who are the people we need to follow more aggressively and who, like your friend, we might be able to follow at every 2-year intervals, if they're on that lower risk
Oh,
of breast cancer. So it's definitely going to help us get a more individualized approach for breast cancer. AI is going to help us identify with more greater accuracy. It's going to make radiologists more accurate in deciding who we really need to call back and what the likelihood of something that we see being breast cancer. It's going to help patients understand their reports better. Like it might be able to give it to you in layman's terms, or I've seen AI where it kind of almost gives you like a little reel explaining your personal breast density, your personal risk, things like that. And scheduling, everything in the radiology side, scheduling to report generation, to report getting results and things like that. It will help kind of streamline that. So I do
wow.
think it's really going to expand a lot in the next 5 to 10 years. I'm
That's
excited for that.
really
Yeah.
exciting, really exciting. And the heart of it all, if you are younger, especially
Hmm.
because I never learned about breast health when I was younger, and
Hmm.
there were so many people, most people, didn't. And
Hmm.
that is why I'm so focused on educating these younger folks and getting other people to educate, so that we just have,
Hmm.
just knowing what the signs of breast cancer are, knowing your own body, being familiar with your own body, knowing how to do a proper breast, excuse me, breast exam. Because I mean, most of us just was like, oh, you just, and then you go into your OB and they just kind of feel around, but nobody really knows how to
No.
really do a proper one. And so this is what my efforts are to get into our community to teach that.
I'm so happy to hear that. And, even going back to the recommendations from the American Cancer Society about the self breast exam, they don't technically recommend it. They don't, which is unfortunate because, again, we're having all these young people being diagnosed with breast
Mhm.
cancer and they're finding it themselves. And if you're going to tell them, they say they don't formally recommend the self breast exam, but they recommend self breast awareness. And to me, that's like the same thing. It's like, okay, right. So going back to like the paternalism, like look but don't touch, like what exactly are we doing here? And why is it that women breast cancer screening recommendations are so like flighty and
Mm.
non-confident, and it really causes confusion amongst women. And this is why I think that, and that's why I think that social media is able to run with it, because there's like all these conflicting things about how often, when to start, who should be getting screened, that it gives people room to like, say, oh, they don't want you to get it at 40 because it causes cancer. They're right. So
So
I
we,
just feel like I wish we would have concise recommendations that really have the data and evidence to prove it
so we just
behind
need,
it.
we need to be consistent with factual information, and don't let up. Just keep doing what we're doing, I
Hmm.
guess, right? Um,
Absolutely.
yeah, that's
And
great.
patient advocates are so important because, like, women like you who've been through it, speaking up where we went wrong, like where, if you weren't screened, because, I'm seeing young women being told like they're too young for breast cancer, don't worry about it. And so it's really just, we need to educate, like, patient advocates are so important because they really give a face to the disease and experience of the disease. And that also so important. My own cousins, actually, going back to like how I became the Boobie Docs, my own first cousins, when I was in med school, my cousins, Melanie and Michelle, who were about 10 years older than me, were diagnosed with breast cancer. One of them felt a lump in her early 30s. She went to the radiologist. They said it was probably just a fibroadenoma, come back in 6 months. She advocated to get it biopsied. It ended up being a triple positive breast cancer. She was, she this was 20 years ago now, but she advocated to get genetic testing at the time. Like, her friend had heard of that lived in New York, had heard of this testing. So she pushed to get genetically tested. And lo and behold, she was BRCA2 positive. And then I'm sorry, BRCA1 positive. And then her sister, because of that, she was in her mid 30s. She decided to push to get a mammogram. She ended up having breast cancer and BRCA1 positive as well. So going back, like, it's in my blood for this to be an advocate into, especially in young women.
Yeah. And that's what we do. We arm women with being able
Hmm.
to advocate for themselves. I learned how to advocate for myself when I got breast cancer. I was
Exactly.
54 at the time,
Hmm.
and I'm in June it'll be 4 years. So
Oh man.
need to get to that 5 year
Amazing.
mark. But
Yeah.
I had to advocate for myself with a few different things. One being, um, there was some information that was given to me by my oncologist that was not true. There were some mistakes, and I love her, and she saved my life and all the things. But I had to really pay attention to what I had been told and the notes that my husband had taken, and I had to correct her. So I actually had to use my voice with a
Hmm.
doctor and tell her you are wrong.
Yeah.
And but also with my breast surgery, I chose to go and get the deep flap surgery in New Orleans. And I had to fight my husband on this.
Hmm.
And, he's like, you're going to fire you, because we don't have that kind of surgery in our area. So I had done all this research and told him that I was going to New Orleans, and I wanted him to take a look at the hospital that I was going to go to. And he was just fighting me about it and telling me, why do we have to travel? And at some point I just had to say, babe, this is my body,
For mine.
not yours,
Yeah.
my body. I own this and I am going. You are going to be there or you're not. And that's what really flipped him. And he's like,
Hmm.
oh my God, I'm so sorry. Yes. Okay. So he'll tell you
Yeah.
it's the best thing I could have done, but I really had to advocate in that way too. So a doctor, a
Yeah.
woman, her doctor tells her these not new
Yeah. Yeah.
recommendations from
Hmm.
the College of Physicians. What can she say to the doctor?
Yeah. You know, I many most cancer experts really believe in annual screening. Mammograms save the most lives. I am proactive about my health. I would really like to get an annual mammogram or start now at age 40. And if they give, you don't need it, well, I would like that. If, again, you are part of your team as much as your doctor. And
Mhm.
a lot of times doctors, they may not mean ill will from it. They're just following
Right,
recommendations.
right.
But again, they have to listen to the patient. And if you're a proactive patient who is pro screening, wants to find their breast cancer early, and if they're fighting you on that, I do feel that it might be time to find another doctor, because you want someone who's going to value your opinion, not be fighting back, because all it takes is one of their patients to be diagnosed with breast cancer at 41, and then they'll change their tune. But until that
Mhm.
happens, you don't want to be that one patient, though, right? That has to change their tune. So,
Right.
you know, women are less likely. women who get annual mammograms are 40% less likely to die from their breast cancer. You know, you could give him facts, you could give him all the reasons, but again, if they're pushing you a lot, like find another healthcare professional. And I think that we have to get comfortable. This is what I would like to do. My breast cancer screening, ultimately, it's a shared decision-making process between the doctor and the patient, and I am proactive and I have dense breast tissue. So I also want an ultrasound as well, you know. So maybe you're the first person to teach them about this, and that really the data does show that annual mammograms do save the most lives. And I think we all play a part in that teaching.
Yeah. Well, in my show notes, I would love to be able to put any resources that we can have on there. And I will also put them on my website. I've got a whole little ecosystem of resources that I've collected throughout the last 3 years of podcasting. So, so to kind of wrap up here, what is the single strongest piece of advice for women that you would want to be proactive about their breast health right now?
You are not too young for cancer, okay? Whether that's breast cancer, colon cancer. So make sure you're up to date on your screening, your age appropriate screening. Make sure you know your body, because 80% of young women are finding their own breast cancer. So get familiar doing a monthly self breast exam. I always share on the Boobie Docs, Feel It on the First, where I teach the self breast exam and give you a reminder in case you forgot. And, you know, advocate for yourself and others. Speak up about, you know, if doctors are not, become familiar, you know, ask ChatGPT what screening recommendations you need based on your age, and bring that information to your doctor and advocate if they're telling you something otherwise. And don't be afraid to speak up or find another healthcare professional.
Yeah, it's the hardest thing to use your voice and to hear yourself actually asking a question or telling a doctor or your husband or you know, whoever is pushing back. It's hard for us to get that out and bring up something like it's like an elephant in the room, right? But
Exactly.
it does bring us to better outcomes. And so, well, and also you have a podcast.
I have a podcast, The Girlfriend's Guide to Breast Cancer, which is really to help people navigate through a breast cancer diagnosis or support a loved one. So in each episode, we talk to, like, the first few episodes are like, after a diagnosis, what happens? You see a surgeon. We have an interview with a breast surgeon, a radiation oncologist, you know, a plastic surgeon. We talk to lots of patients and get their best advice and things that they wish they knew. So it's really helpful, and especially if you or someone you love has been diagnosed with breast cancer.
And it's fun. I started mine as a healing
Thanks.
mechanism. And then I realized that, oh my gosh, it's really helpful for a lot of other people too. And you probably get a lot of messages like I do, text messages, emails, whatever. Hey, it's because of you. I went in and got my mammogram. I hadn't had one for 2 years, or I found a rash on my breast and it's not going away. I'm going to the dermatologist. And, you know, so it's just, you know, that you're
That's
making
rewarding.
a difference.
Yeah,
It
like
really
that's
is.
why, and I think that's what keeps people like you and me going online and putting ourselves out there, because you know that the work is helping people. Like, I get messages all the time that something that they learned on my page either helped them find their breast cancer early or thrive after a breast cancer diagnosis. And honestly, there's no better feeling in the world.
Really, truly. And I started a nonprofit all around that. So,
That's
and now it's
amazing.
just starting to take off. And so I'm excited about it. I've got a full working board and all these volunteers, and I've got this thing going. And so, yeah, it's very rewarding. Well, I
Yeah.
really, truly appreciate your time, your
Thank
efforts. You're
you.
super fun. You know, you just have such a fun presence out there as
Thank
well. So
you.
you make learning about boobies a lot more interesting, and it's just fun to watch. And I will have
Thank
all of
you.
your social media information. And if you if to my audience, if you
Go
haven't
check out
gotten
everyone.
Everyone Has Boobies, we'll have a
Yep.
link
And you
in
can
the
find
Mhm.
And you can find everything about me, too much information, on the boobiedocs.com. You can get my socials, you can get my book, you can see my podcast and everything like that. So
yeah,
hope you
so we'll
check it
just
out.
put that on there. Yeah. Well, I appreciate it. Do you have anything to say
Thank you.
before we wrap up today?
No, I hope you have the best day ever.
I hope you have the best breast day ever. We're up here in beautiful Grass Valley, California right now, and it's beautiful. And
Amazing.
yeah, well, thank you, Robyn. And to my
Thank
audience,
you.
thank you so much for joining us again on this episode of Test Those Breasts. And we will see you next time on the next episode. Bye for now.
Bye.
Friends, thank you so much for listening to this episode of Test Those Breasts. I hope you got some great, much needed information that will help you with your journey. As always, I am open to guests to add value to my show, and I'm also open to being a guest on other podcasts where I can add value. So please reach out if you'd like to collaborate. My contact information is in the show notes. And as a reminder, rating, reviewing, and sharing this podcast will truly help build a bigger audience all over the world. I thank you for your efforts. I look forward to sharing my next episode of Test Those Breasts.